All right, welcome back to the Live at 5:06. All right, gonna get started in just a second. All right, so welcome everybody. Welcome. Gonna give it a couple seconds to get people in the room. Got some really important topics to talk about today. Super important, really important. And if you're a moving body, this one's gonna be you're gonna want to listen to all of this stuff. Hey! Welcome everybody. Let me know where everybody's from. Where's everybody from? Type it into the chat. Let's get all warmed up and cozy. Got some real important topics to talk about today. So super excited. Where are we all from? And don't just say New York. Don't just say New Jersey. Tell me the city. Tell me the town. Let's get personal. What town you from? All right, so, Paramus, nice, very good, very Cleveland, love it. I'm down in Brooklyn, down in Brighton Beach. So as we get all settled in, two things I want to really talk about today. Really important topics. One is not all movement is the same. I get a lot of times that what I want to really start doing is through these lives, I want to start talking about the things that come up in my office all the time. One of them is, this hurts, and so I'm afraid of doing this or moving in general, and that is really not the way we need to think. So that's the first thing I want to talk about, is not all movement is the same. And number two is managing your expectations. Now, this is not what you think it is. This is not what you think it is. Managing expectations, what I mean is, if you're someone who's in pain, right? Whether it's neck pain, shoulder pain, back pain, foot pain, whatever it may be. If you are expecting pain, you're going to be in pain. If you don't expect pain, chances are you won't be in pain. Now, it sounds kind of like silly, pain's just not going to magically go away, but it kind of does. So I'm going to get deeper into that so you know what I'm talking about. Let's start with the first thing. Oceanside, California, but live south, 30 minutes in San Diego. I really want to go to San Diego one day. So let's start with the first topic. Not all movement is the same. So who here, and again, write into the chat, I'll give it a few seconds, but who here has pain upon movement? And if you do, which movement? Is it walking? Is it running? Is it lifting? Tell me a little bit more, just write a couple things. Pain on reaching for a bowl. Pain upon knee pain. Okay, so Yanka, I hope I'm not messing that up. But knee pain, when do you have knee pain? Right? Is it through standing, through walking, through running, speed walking, lifting? When is your pain being triggered? Sitting, doing squats. Great. Okay, so, not great, but thank you for that information. Veronica, moving side to side, left side, most of all. Also, great information, right? So, the chances of you doing squats probably are less likely that you're going to do them, right? If something hurts, we typically stay away from them, and that's understandable. That's normal, right? And what we need to do, right, rather than avoiding a very functional movement like squatting, because when we go to the bathroom, we squat, right? It's just what it is. When we go into a chair to sit behind a dinner table, we squat. When we go behind a desk to work, we squat, right? So squatting is unavoidable, right? Moving side to side is also unavoidable, right? We reach for things all the time. We bend to reach things all the time. Again, it's a normal part of life. When we're in the bathroom, we rotate our bodies and we bend too, right? These are all natural things that happen. So even though those movements hurt, it doesn't mean that they have to hurt or that they will hurt long term. And it's really about finding out how can we incorporate good movements so that it doesn't hurt, right? And whether your pain is at night, whether your pain is at any time, you have to make sure that we find a way. So let's say deep squats hurt, right? So I'm going to give an example. I deal with this all the time in the office, right? Getting down to a squat position, this, no good. Well, how about halfway? Can we get halfway and maybe do some rockers, right, through the feet, where we have a nice solid base, we're not too low, whether it's the knees or the hips that hurt or whatever it is for your particular situation. How can we incorporate movement that doesn't hurt? Or, if it's the knee pain that hurts, why not do a little seated exercise where, hopefully everyone can still hear me, where you're leaning over your knees right here and then lifting the ankles, lifting essentially yourself when you're leaning on your knees, just lifting through the ankles and through the feet, providing some extra support at the knee and the lower half of the leg. Right? So it's really about finding, what is the thing that's causing you pain, right? You don't just have knee pain out of nowhere. What is causing your pain, and how do you get rid of it? Through movement. Movement is the answer. Drugs are not the answer. Surgery is not the answer. Injections are certainly not the answer. Movement is. And even people who have bone-on-bone arthritis, which is I hate hearing that phrase, but bone-on-bone arthritis, where theoretically your pain is coming from that arthritis, there's nothing you can do. That is a load of crap, to be honest. When a doctor tells you there's nothing you can do because you have bone-on-bone arthritis, that is a load of crap. And I know because I've worked with people who have bone-on-bone arthritis, who were told they need surgery, they have all sorts of pains, they need to be on medications. Bullshit. I call bullshit, and we got rid of the pain. So it's really about finding what is the right approach, what is contributing. Yes, okay, you have arthritis, sure, but these are age-related changes. Same as when you get a diagnosis of, stenosis, degenerative disc disease, which people love to freak out about for no reason. It's just age-related changes. It's really not a big deal. The pain associated with the diagnosis can be a big deal, but you can navigate it so that you don't have pain. That is for damn sure, right? Again, because I've done this so many times in the office. It is possible. And you ask any good therapist, it is possible. So that's really, really important. And again, someone asked, what about right side neck pain? It depends, right? Again, this is the whole point of the conversation is what is causing you that pain and how can you get rid of it? The how and the what is not as sexy as me just showing a stretch, I understand, or not as informative, but it is really important to get down to the root cause of the pain. Again, all the people who come to me who have really bad knee arthritis, who've been told they need surgery, it's about finding what else is contributing to that pain in your knee. What other lifestyle things are going on that are contributing to that pain in the knee? A lot of times it's a lot simpler than you think. And just a few weeks of effort, even a few days of doing the right things can already drastically, and I mean drastically, reduce the pain. Okay, I have doctors wondering how did you do this? Because this person's pain is gone. And again, it's just that approach to movement and to the approach of finding out the why and the what. Because that is really important. Because then you can bring all those movements back. There's no reason why someone with arthritis cannot squat. Absolutely not. There's no reason why you can't. Again, considering we do it all the time, every day, there's no reason why you can't do it in a way where you're doing it for exercise, right? And that's really, really important. So again, whether we're talking about squatting, whether we're talking about rotating or side to side, right? If side to side movements are painful, well, we got to think about, okay, what is happening? Is it more along the tissue and structures of the spine? Is it something that one of your lateral flexors are tight? Maybe it's coming from the other side. Maybe it's coming from your hip. There could be so many things that's going on, and people who have been in pain for a long time, who've been through multiple providers, and are thinking, well, no one's able to help me. You just haven't found the right one. Last week we spoke about window shopping for a therapist, or window shopping for a chiropractor, or window shopping for a doctor. And don't stop at no, and don't stop at it didn't help. Find someone else, and I can assure you, you might walk into someone's doors and they will be the ones to get you out of pain and to help you. I find on days off, riding, it bothers me all day. Again, we got to find out why. right? If you're resting and there's pain, we have to find out why, right? At rest, unless you're dealing with soreness, right, and just like muscle fatigue, which is entirely different story. If you're having pain on rest days or on days off, we need to find out why that's happening. That's not a typical response of the body, right? But this is something that's super important, and something that people need to realize, that their movements can be tough until they're not. And once they're not, life becomes a lot better and easier and more fun. I've had tons of people come into my office who couldn't dance. Before they loved dancing, but because their pain happened, it just hasn't. They just haven't been able to dance. But then we get them back to dancing, right? Or people who want to play tennis recreationally. Can't do it. Oh, well, you bet I'm going to get you back to it. Running around, kicking everybody's ass in the court. So it's really finding a specific approach to you and specifically you that's going to really help you the most. And that's really important. Is there a specific stretch you recommend for hamstring tightness? Does foam rolling help? Ooh. Ooh, two questions that are I have some delicious answers for you. First of all, let me do foam rolling first. So, look, foam rolling in terms of like injury recovery, there are so many more beneficial things that you can do than foam rolling. Foam rolling on its own is nice for recovery, and it depends what you're foam rolling. Like, for example, never foam roll your IT band. You're not doing anything there. But foam rolling on its own for general recovery, kind of like those massage guns, right? For an injury, treating an injury, not really going to do much for you. As a way to just recover from training or recover from soreness, okay, then we can talk. It can increase some blood flow, increase some circulation, and that's great. But foam rolling on its own, on just face value, no. I have never, not once, recommended foam rolling for injury recovery. That's absolutely, it's not helpful, and it's just not. Again, there's so many other beneficial things that you can do. In terms of hamstring tightness, a lot of people stretch and stretch and stretch and stretch the hamstrings, or that goes for any muscles that feel tight. The best thing that you can do for a chronically tight hamstring, and you stretch it every which way you can, is active stretching. So you're not just holding it for 20 seconds, but you're actually going through these shortened and elongated phases of the muscle. That is going to be super important. And also actually using the hamstring, and it may seem counterintuitive, but using the hamstring can unload tension on the hamstring, which, that's golden advice. And not a lot of people know that, or more people need to know that rather, that using a muscle can decrease tension. For example, in your calves, right? If your calves feel really tight, or your squats are limited, for example, if your squat depth is limited, a lot of times it's limited because of a lack of ankle range of motion. That could be coming from your calves. And the way to improve it is not to stretch it, but to use it. So using the hamstrings in a way that can actually decrease the tightness. And actually, to quickly show you one before we go on to the next question here, let me show you a really quick hamstring move that actually doesn't require any weight. There's two really good moves actually. Man, there's so many. But I'm going to show you two. One is a more active range of motion stretch kind of deal. All right, so we're going to bend the knee, send it behind you and up towards the ceiling. You're going to feel it tightening through the hamstring. Hold it there for a couple seconds, bring it through, kick it out until you feel a stretch. And again, close it up, send it back and up, right? Not this way, but up this way. Again, tightening it through the hamstring, kick it forward, and get a stretch there. Hold each position for 2 seconds. So that is a great general hamstring stretch. Another one is a single RDL or a single Romanian deadlift. You can use this with weight and without weight. Personally, I would recommend without weight first. I like to do it the more challenging way. So leg is here. You're going to hinge forward until you feel a nice stretch through here. Knee is slightly bent. Hold for a few seconds, and then come up. Okay, and again. Bend forward, get as close to parallel to the floor as you can. Keep the knee bent a little bit. Get a nice stretch through here. And you're stretching it, and then you're using it, you're squeezing through, pushing through the floor, and coming back up, and it feels great. The easier version of that, instead of having the leg up, you can just have like the big toe of the back leg on the floor, then forward, get a push, rather stretch, push to the floor, squeeze through that leg, and then come up. So those are a couple of things that you can do. But again, you got to find out what's the best approach for you. Which muscle in the hamstring group is the problem. There are multiple. Does MRI diagnose? How do we diagnose? So MRIs and scans. So this is actually a great question. MRIs and scans give information about what's going on, right? So you can get an X-ray and you can see, okay, there's arthritis. You can get an MRI and see, okay, there's a disc herniation. But did you know that not all people who have disc herniations actually have pain? Right, so what did the MRI actually diagnose? MRI just showed you have a mild disc herniation, but yet it doesn't impact the person, right? Or it shows that you had at some point a disc herniation, but at this current point, that's not actually what's causing you pain. So an MRI or an X-ray or the point of scans as a whole is to give you more information about what's going on inside the body, right? Someone can come to me with some shoulder pain, and I'll be like, okay, from how you're presenting, from what's causing you pain, from the special test that I'm doing here, it seems like you have a rotator cuff tear, right? And let's say, of the 4 muscles in the rotator cuff, let's say it seems like you have a supraspinatus muscle tendon tear. Okay, well, I can tell you that, but the only way we'll really know for sure, like 100% know for sure, is through getting an MRI. The MRI will expose that soft tissue injury and confirm that there has been, in fact, an injury. All right, so it gives you that general diagnosis where it gives that information of what's happening internally that we cannot see without the use of these technologies. Again, we have tests that can indicate certain injuries, whether it's a fracture, a muscle tear, a ligament sprain, and all that, but that's all it is. So when someone comes to me with pain, a lot of times the question I get is, oh, should I get an X-ray, MRI, or should I bring you my MRI results? I'm like, well, if you have them, sure, but it's not like you have to go out of your way to take it. Most of the time I can find out what the problem is anyway. If something is super, super serious, then I'll recommend, okay, you should get a scan done, and I'll be very upfront about that. But that's like 99.999% of the time, I know what the problem is, and there's no need for a scan. And even if there is a scan, I'm like, okay, well, this kind of confirms exactly what I was telling you or exactly what I was saying. So, again, it's not that don't focus on what the MRI says, or at least I don't focus on what the MRI says, let me put it this way. I don't focus on the scan, I focus on you. I focus on you as the individual, as the person walking through my doors, presenting with the pain that you have, and I'm looking at you of how do I fix this pain, not what the scans show me. Again, I had a scan done and it says that I have early onset of stenosis. I should technically be in pain. I have no pain. All right, my scan does not make me. Same as your scans do not make you. Even if you just got injured and it shows you have a disc herniation or a rotator cuff tear, great, that's information. That's information. Where do we go from here? Right? I'm still like if I'm treating someone for disc herniation and I suspect disc herniation, if they get a scan 3 weeks later confirming that disc herniation, my plan doesn't change. We continue onwards, right? Just one piece of the puzzle. Exactly. It is a piece of the puzzle. But you are the puzzle, right? These are bits of information that make up who you, not who you are, but the issue that you have. And again, we don't need it. Most of the time, we don't need it. It's good to have, right? Same as it's good to rule out, by going to the doctor first, it's good to rule out other systemic issues before you go to see a physical therapist for a certain pain, right? Especially if that pain is, similar to something else. But it's all a piece of the puzzle that we have to find out of how do we get you out of this pain? How do we fix this injury? How do we, whatever it is, right? It's the same as, And it's the same for every condition, really. It's the same for every condition. No matter what the injury is, it's all a piece. Right, it's a static photo, always much more complex than that. Exactly. It's always much more complex. It's always much more complex than that. And we have to understand that. And also, we have to not be afraid of the scan. A lot of people are terrified. A lot of people cling to that piece of paper where it says that they have a tear or they have a disc herniation, and they're like, I'm going to have pain. And what makes matters worse when it comes to disc herniations, this is what bugs me the most, that some doctors, not all, and I know some fantastic, amazing doctors, but some doctors insist on saying, you're going to live with this for the rest of your life. What kind of, oh my God, that is some fresh out the oven bullshit right there. And I can't believe that people are still told this. Today, people are still told this, and it makes people so afraid of doing anything. And thinking that they're going to be in pain forever. What you think and what you perceive your mind to be, in terms of like, what you perceive your pain to be, is what it's going to be. And this actually, ties into the next topic I want to talk about, but oh my God, I cannot believe that people are still told that they're going to be in pain for the rest of their life. I just cannot believe it. That's crazy. And again, someone who had a disc herniation, I had a disc herniation about 6-ish years ago. I have no pain. I'm still doing the exercise that caused me that disc herniation then. I'm doing it today with double the weight. So come at me, bro. I can't deal with it. I get liquid built up in my knee, but not enough for surgery. The pain comes and goes. Again, what's causing that liquid buildup? Right? Is it a lymphatic issue? Which it could be. I mean, who knows? Like, that's why it's really important to get tests done and figure that out. Or is there some kind of like bursitis that's causing irritation and inflammation in the knee? What is causing that buildup of fluid? Right? Is glute tenderness, tightness with leg pain indicative of sciatica? So let's go over that real quick. So sciatica, what is sciatica? Real sciatica is an actual disc herniation. So when a disc herniation to put it simply, when a disc herniates, it presses on the spinal canal, on the nerve branch as it goes down into the sciatic nerve and down the leg. So sciatica really would indicate, you'd have a disc herniation to have sciatica. You can have peripheral nerve impingements, which is like as it goes out of the branch, somewhere along this branch, there's some kind of compression happening. But it's, in this case that we're talking about, it really depends. I mean, you can have tenderness and tightness with leg pain. It could be IT band syndrome. It could be some kind of compression happening at the hip along the sciatic nerve branch. It's really hard to tell. You could have some kind of compression happening at the actual, like, more closer to like the low back area where they're in the small, tiny muscles like the QL, multifidus muscle groups. It's really hard to say. Your best bet would be to come to a physical therapist and make sure that you find out what the root cause of pain is. It could be so many things. It's really hard to say. Location matters, symptoms matter. Things that provoke the pain matters. There's so many different factors that come into saying, what is it? It's like 3 symptoms can indicate 10 conditions, but which one is it? We got to confirm, right? So it's kind of, again, I know that's not really an answer, but it all really depends on how you treat it. If you can find out what the cause of it is, then you can actually treat it and actually can go away. And again, that's with any video, any issue. I was reading the next comment. With any issue, you need to get down to the root cause of it. Love watching your video. Thank you. Thank you so much. The docs scare them into that mindset, hard to combat. Yeah, when fear is, once fear enters your brain, it's very hard to fight that fear. And it's really, to get that fear in your head in the first place is really, that's all. I deal with that a lot in the office. People come to me scared out of their mind that, like, again, most people who I see, about over 90% of my patients have been to other physical therapists, all the chiropractors, all the doctors, all the sports specialists in the city, NYU, Columbia, all these places, and they're terrified and still stuck in really bad pain. And it's like, we got to deconstruct the whole thing and start from scratch. We have to break barriers apart. We have to re-educate, and it's really that process that brings people out of that pain. I've seen people who've been to 10 different providers, 11 different providers, 5 different providers. And it's really once you break apart all these little fear parts and anxiety and stress that comes with living with pain, all of it just opens up, really. When someone comes to you with knee pain, can you figure out why without an X-ray? Yes, no, usually. Yes, usually. Again, there's tons of different tests that I use to figure out what the actual issue is. Sometimes it's a really sneaky issue, but we find it anyway. But X-ray is not really necessary. It's really not. Again, even if you have arthritis, it does not mean that you have to be in pain. If you have an ACL tear, I'll most likely know that it's there or has some kind of injury. And if sometimes I will tell patients, listen, I think you have such and such. It would be a good idea just to confirm. We'll still continue onwards, but just to confirm it's nothing more serious. It's due diligence. Then, I'll advise. But typically, that happens very, very rarely. Usually people also come to me with long-standing issues. So let's say 3 to 6 months plus. And yes, 3 months is a long-standing issue. 2 months is a long-standing issue. 1 month is a long-standing issue. If you have pain for a month, that's 30 days. Okay? 30 days. You're in pain for 30 days. That's a lot of days to be in pain. Right? So just think about that. You have some good information that you're sharing. Thank you. No, I tried. Facts. You need a full body evaluation. Yep, everything is connected, right? And also that's another thing, just to go back to the whole, because the knee pain's been coming up a lot. Your knee pain is not just knee pain. All right, we got to think about what's going on at the hip, what's going down at the ankle and foot, what's going on at the big toe, because big toe, a dysfunction in your big toe, well, guess what? That can lead to knee pain. There are so many different factors, and it's not, a lot of times I hear and see therapists, chiros, doctors focus in on just one spot, right? And it's never just one spot, right? Because in this one spot, a lot of stuff goes into that one spot. And that's another really big issue. You can't just treat one area, and that's it. It's not like you're treating the tip of your finger, and even that goes up into the forearm, right? There's so many different things that go into the treatment of a joint, of an area, and that expanded approach mixed in with a specific root cause knowledge, that brings upon relief. I have extreme lower back pain on the right lower side of my back where the dimple, what do you think causes it? Again, another one of those things I don't know. It may seem specific in terms of location, but there's so much that happens. For example, low back pain. I've seen so many times where people have had low back pain for 10 years and thinking everyone focuses on their back, but the problem is actually coming from the hips. And no, hold on, before you think, well, my hips might be out of alignment. No, you get that thought out of your head right now. There is no such thing as your hips are out of alignment. There's no such thing as your body is out of alignment. Get that in your head right now. Unless you have scoliosis where there is a literal spinal shift, okay, your body is not out of alignment. That is not a thing. It's not. Oh God, I have to stop myself there because I'm gonna go crazy. Gosh. Let me scroll down here. Yeah, that's I can't. That's crazy. I love how you value people's time. 30 days in pain is too much. Hell yes, love it. Yeah, exactly. 30 days is a long time to be in pain, right? 7 days. Just think about it. If you're in pain, think about just day to day. 1 day of pain is already too much. It sucks. 2 days of pain sucks. 7 days of straight pain, that ain't no fun, right? So 30 days that's time that you're spending in agony, suffering, not able to, whatever it may be, play with your kids, go to the gym, run down the track, I don't know, punch a wall. I don't know, whatever it is that you like doing. It's a long time to not be able to enjoy your life, right? On a day-to-day, we should be able. Pain is the last thing we should be thinking about. And no, I'm not talking about that tightness that you feel in the morning. Like that is one thing, but feeling actual pain, it's an issue. It's an issue. Any help with Taylor bunions? Can that cause issues beside foot? Yeah, in terms of bunions, I mean that's more of like a podiatry issue. There's tons you could do for bunions, and really depends on the bunion. I'm the son of a podiatrist and a very good one at that, but yeah, bunions, that ain't me. That ain't me. Needs to be evaluated. Can be the feet, hips, etc. Exactly, and that's what we were talking about before. Everything is connected. When we talk about the knee, everything is connected. The foot, big toe, all toes, but big toe, hip, and everything. And also, your knee can also impact other things. Like I've had people come in with, like, let's say right knee pain, but then left shoulder and neck pain too. And you might think, well, those two are kind of unrelated, but they actually can be related, very much so. Someone who's been in pain for a while will compensate away from their right side into their left, causing a slight hike in the left shoulder, and then tightening through here, and then it's like a whole bunch of other issues can combine together, or it could be separate too. But my point is, there are so many different things that can contribute to one another that seemingly have no connection, but actually do. And that's the beauty of our body. Our bodies are incredible. They really are. Your body can do so much more than you think, and it is really incredible to see the people transform in my office from day one to when we finish a plan of care, and it's really, truly, purely magical. It's unbelievable. Someone coming in thinking that they're going to be in pain for a long time, there's nothing that can help them, that they just have to accept what their situation is, and then it's not that same situation at the end of it, and people's lives are unlocked. I'm not going to get into specifics of like who and what the situation is, but I had a patient sit in front of me, and she had, at the end of their plan of care, she had tears of joy because she never thought that she can actually do things like play tennis or put on heels again or just wake up and take her child to school without pain, and that the rest of her life is actually pretty limitless. And if she does feel pain at some point, because we're not robots, we're not machines, she knows exactly what to do to tackle that pain. Like it's amazing. It was actually truly amazing the first day she was in, where she thought, like, I don't know what to do with this pain. It's been around for so long. It was like at least 2 years, and then to crying of, I can't believe I finally have my life back. And that's what we do. That's what I do in my office. That's why I open up my own practice, to give those kinds of experiences of, listen, let's find the problem. We're going to make it better. Introduce movement back into your life. She was running up and down this gym here, as if there was no problem, bending and twisting and jumping, and it was incredible. And again, it doesn't matter what the injury initially was. The fact is that we can get from point A to point B, and from point B onwards, it's an incredible experience. You get to enjoy life again, and that's really magical. I have bulging discs, L3, L4, L5, causing pain down my legs. You got any exercises to help? Tons. If you actually, in terms of like disc herniations, again, always best to go to see a physical therapist. Again, it also depends on, like, there's so many exercises and so many moves that you can do, but it really depends, like, what are your symptoms actually. Remember, it's not the scan image that's important. It's what are you currently presenting with. That's important. So even though you might be having L3, L4, L5 disc herniations between those segments, what is actually happening? What are you actually feeling? And like that's more important than disc herniations at these levels. So yes, there's tons of exercises, but you need something specific. And if you have that kind of injury, you need a specific approach to your injury. Are you in New York? I want to come see you for my back pain. Yes, definitely New York. So you guys already know, backing me up. Yeah. I'm in Brooklyn, New York, down in Brighton Beach. I work with people virtually all over New York State, in Jersey, in Florida. I have a physical location down here in Brighton Beach. And if you want to work together, if you're in pain, tired of it, want to be done with it, click the link in my bio. There's a link for a free 30-minute session, and let's find out what's causing your pain. Let's get rid of it. Enough is enough. Let's get rid of it, right? So if you're interested in that, in working together, click the link in the bio. There's a free 30-minute session there, and we can't wait to talk to you, all right? Get you figured out and feeling much better, grooving and moving all over the place. Thank you, love your moves. It's a pleasure. Does heel pain, plantar fasciitis ever heal completely? Yes. I actually had someone come in with bilateral plantar fasciitis, long time, not to mention Morton's neuroma on both legs, on both feet, where this person had a standing job, a lot of pain, a lot of pressure through their feet, and they had plantar fasciitis for a long time. They tried the shoes, they tried the injections for the neuromas, they tried a whole bunch of stuff. Not until it came through my doors did the pain go away. Plantar fasciitis, what annoys me with that is that there's such a generic, which is the problem with any issue that we even spoke about before and in general, there's such a generic kind of approach to plantar fasciitis. It's like you do one of 6 moves and that's it. If it didn't work, deal with it. But that's not right. And so plantar fasciitis, Darren and I, we both eat plantar fasciitis for breakfast. It's easy. It's really easy to get rid of once you actually not only identify the plantar fasciitis, right? Because what is it? What is plantar fasciitis? It's an irritation of the fascia right on as the fascia goes across the middle of the foot into the toes along that muscle group. But what is causing it? Is it foot position? Is it what is going on at the knees? How are you carrying your weight? Are you more forward weighted or back weighted? Right? There's so many different factors that go into treating plantar fasciitis, but it can go away. This person has been pain-free from plantar fasciitis, considering they've been in pain for years. We finished 6 months ago. They've been good for all 6 months with the neuroma, by the way, which is also pretty cool. Because theoretically with Morton's neuroma, that's pretty painful and that doesn't really go away. And that's another whole other discussion and topic of Morton's neuroma, but the plantar fasciitis is completely gone. Again, I open up my practice to be very results driven. It drives me nuts when people don't get results. Again, as someone who has gone through the system when I had my injury and I had no results, I cannot stand people not getting results. And that is exactly what I do. I do my very best in here. Both Darren and I, we are very result driven. So whatever's causing the actual irritation in the plantar fascia, we find out what it is. It's not so simple in terms of it's not just straight cut forward. That's why so many people are still stuck with it. But yes, very long answers here. But yes, we can definitely heal it for good. Why do we feel stiff and sore first thing in the morning? What is the physiology behind it, and why does it get worse as I get older? Well, look, as we age and as we get older and as we go through life, right? When we're 18 and going through high school or college, we are much more active than when we're older and have responsibilities, like going to work. And where we work, we sit from 9 to 5. If you have a desk job. Or you're in really crazy positions. It's really hard to say why. There's so many things that can go into the why, right? Lifestyle. Are you moving before and after bed? Are you incorporating movement? And I'm not just talking running or lifting. Are you incorporating movement that improves joint range of motion, mobility through the muscle tissue? Are you including these things into your daily life? So, again, I've worked with people who have, they came in with chronically waking up feeling really stiff. Not that they were in pain, right? But they're just really stiff. And that went away once we incorporated certain movements for whatever was feeling stiff or causing that stiffness. Now, people keep telling me, I treat people of all ages. Like I treat people as young as like 7 to like 70, very wide range. But even the 70-year-olds that I treat also want to remain active. Like everyone wants to stay moving, which is awesome. Like I love working with people who want to stay moving. And I get people who are in their like 40s, 50s, 60s, even 30s. That's super young. But they're like, it's my age. I must be getting older. That's why I can't move. I'm like, shut up. No, in the nicest way possible. It is not your age. Age is it's so funny. Age is a state of mind. You are as old as you think you are. If you think you're a 60-year-old in a 30-year-old body, you are a 60-year-old in a 30-year-old body. If you are a 60-year-old and you think you're a 60-year-old and that's why you're in pain, that's why you're in pain. That thought process right there, that's why you're in pain. That's why you're stiff. And it's not like, disregard age entirely. It's not that. But it's your mindset. Once you flip your mindset of, who gives a shit? So what if I'm 70? So what if I'm 40? So what if I'm 30? So what if I'm 55? It doesn't freaking matter. Move. Move. The more you move, the more you treat your body, the better you eat, the better you sleep, the better you rest, the better mentality you're in about your body, the better you'll feel. So it's not an age thing, it's a mindset thing, really. And I know this because, again, when these people come into my office and we start working together and their pain goes away, I'm like, hey, how's that age doing? Still a problem? And they're like, ha ha ha, okay, Danny, ha ha ha, you've been hammering it in for about 8 weeks into my head that it's not an age. You know what I mean? So it's not an age thing. It's a mindset thing. It's the way you frame things to yourself, that creates your reality. So it's not a thing as you get older. That's not why we get sick. We got to look at lifestyle. We got to look at how we think about our body. We got to look at how we move. Do we move? And again, it's not just about sitting down or getting up. Right? It's about using all of the juicy, hot, steamy range of motion that we got in our bodies to get really crazy. Awesome. Great. Follow back pain. Someone suggested that wearing cushion paddled heel sneakers are just for aesthetics and not for support. What is your knowledge on this since I add cushion to all my shoes? Listen, I'm a big believer in using your feet as, nothing against you. I have different kinds of shoes, some with cushion, some with not. Are you comfortable? Yes? Great. No? Change shoes. Be comfortable with walking barefoot too. Shoes are really, you got to look at the shoe, right? Is it providing you support? For example, someone just with plantar fasciitis, just a reminder, someone was wearing plantar fasciitis shoes but that shoe didn't quite meet that person's needs, and their feet were falling out of the shoe. Like if this was the shoe platform and this was their foot inside the shoe, for whatever reason, but the foot was just falling out, and so it was considered a really great shoe, but it was actually causing a lot of problems because the foot wasn't quite fitted for that shoe. So whatever shoe you're wearing, whether you want to do with the ones, I forget what they're called, but that has like an individual sleeve for each toe, and it's like almost as if you're walking barefoot, or if you want to wear cushion shoes, as long as it's providing you good support, as long as you're comfortable, that's what matters really the most. And also just be comfortable without shoes too. Like you should have no problem walking barefoot. And if you're not someone who walks barefoot so often, start walking barefoot more often. That's really, really important. So listen, this is a very heavy topic. There's a lot that we can say about this, but bottom line is just make sure you're comfortable. Let's see, what can you do from iliopsoas muscle spasms? Oh, Nathan, bro, I love you too, man. Mogul here, I don't know if anybody saw it, but he's actually one of my best friends from when we were kids. We were friends from like 9 or 10 years old. Went to the same school, grew up together, and still very, very good friends. Love you, man. What can you do for iliopsoas muscle spasms? So this is a cool question. So How do you know it's your iliopsoas? Ooh, fiery question, I know. And this is not me being like mean or anything like that, but it's iliopsoas is blamed all the time. And we have a few hip flexors, not just the iliopsoas. The iliopsoas is just one, right? And we're talking about the psoas major. We also have the iliacus. We also have the rectus femoris. We also have the sartorius, right? Like there's other muscles that assist in hip flexion. So, it's hard to say if you're having spasms or if you're having clicking. Like it's really, it's not as simple as it seems. If you're having some kind of muscle spasms, is it a hydration issue? Is it an electrolyte imbalance issue? Is it that you, kind of like what we spoke about before with the hamstring stretching, is it that you just need to use those muscles in particular? Doing some hip openers, for example, some leg lifts, right? It's really hard to say what can you do for iliopsoas muscle spasms, because what if it's not the iliopsoas? What if it's your rectus femoris muscle? What if it's your sartorius muscle? What if your rectus abdominis is weak, and who knows, right? Who knows? And this is really the point of this conversation. All the moves that I post on Instagram, and everyone posts on Instagram, they're great. They're really, really great. And if you guys have been following me, you've probably been enjoying them, and they've helped you in some capacity. But at the end of the day, if you're really dealing with some kind of issue that's long-standing, get specific answers. There's no one size fits all. There's no one stretch that's going to fix everything, or one exercise that's going to fix everything. If you're having a long-standing issue or an issue that you just cannot get rid of, you've YouTubed and Googled everything under the sun, it's time to get specific help to make sure that you can get rid of this specific issue. And again, I know that's not maybe the answer that you wanted or hoped for, but it's just one of those that's like, I wish I could help more, but it's really about being specific. And I don't want to lead you down the wrong path, because that's not helpful. Can you continue to walk with plantar fasciitis? You can, but it's just, you got to get rid of the problem, right? You can walk with it, but it's like, does it hurt you, right? Because if it hurts you, you got to make sure you get rid of it. And we got to look at what's going on there. But can you continue to walk? We have to walk. We have to walk from place to place. Even if you're just staying at home and you're working from home, you're not really going out anywhere. You still have to walk from the bedroom to the bathroom to the you know what I mean? So walking is unavoidable, but getting rid of the pain is definitely a must. Coming from work to the gym. Oh, me too. Me too. Let's see, 100% starting to lift weights in my 50s, the old lady in the gym. Hey, no old lady, and you don't feel old. Excellent. Excellent. Hold on, let me get to this question here. I hate walking barefoot. I know, walking barefoot can be unpleasant or weird or strange, especially if we're in shoes all day. But again, it's like being able to use the body is really important. So don't hate on it yet. Oh, guys, I cannot wait to go to the gym in a little bit. Someone mentioned the gym here, and I'm psyched. Any other questions here? We have a few minutes left. If anybody has any other questions, definitely drop them in the chat. One final thought that I want to kind of close off on as anybody writes in, it's that mindset thing, is where it's not only just you are the age that you think you are, but something that has been really consistent throughout all the patients that I see is that when someone has been dealing with pain for a good amount of time, they expect it. So it's like if you have pain when you stand up, that moment when you're about to stand up, you're bracing for it. You're bracing for that pain. Why? That bracing or that expectation of you feeling pain, first of all, causes anxiety. Anxiety is linked to pain from the brain. So if you're feeling anxious about movement, you're actually going to have pain with that movement. That's anxiety directly leads to pain neurologically. So that is backed up by science, which is actually crazy. Like that's nuts. That anxiety can cause pain. So when we're expecting to feel pain, you're giving the signal to your brain to, we're about to feel pain, right? We're going to feel pain right now, and then you do feel pain. So managing that anticipation of pain is so important. I remember I was working with this woman once, and she had terrible pain, leaning forward, like tying her shoes, bending forward, just picking up her baby, really bad pain. And the very first thing we did was just breathing exercise, just focusing on just sitting up where that was okay, sitting was fine, that wasn't painful, and just breathing in and breathing out. And really trying to make those breaths as deep but as relaxed as possible. And with each breath out, you focus on relaxing. Right? So every breath out, you relax the shoulders. Breathe in and relax the back. Breathe in, relax the hips. Breathe in, relax the eyes. Breathe in, and so on and so forth. We did nothing else. Nothing else. We spent about 10 minutes on that breathing protocol. And a movement, and I swear, I was amazed. I was just so happy. I was so happy for her. So again, before, this was very painful. Just that slight bend forward. A slight bend to the side, super painful. After 10 minutes of breathing, she was down almost completely parallel to the floor. And I'm not joking, she was almost completely parallel to the floor, and she had tears in her eyes because she couldn't believe that she just did that. Where a moment ago, I asked her to do the same movement, and she was jumping from pain. All we did was breathing. And dropping that expectation of, I'm going to feel pain right now. Guys, this is huge. Drop that expectation, because you are going to be so surprised when you drop that expectation of pain, and that pain is not there anymore. So whether it's standing up, whether it's extending back, whether it's rotating in some form or way, whether it's squatting, whatever it is, breathe, relax. Don't expect pain. If pain happens, that's okay. That's okay. But don't frame it in your mind as, oh, I'm about to do this, I'm about to feel pain. Okay, here we go. 1, 2, 3, 4. Right? None of that. Let's cut that out. And let's change the way we expect movement to feel like. Let's change the way we move, right? Let's stop guarding. The more you expect pain, the more you also tense up. Relax. It's okay. Everything's going to be okay. The moment you let go, it may still be painful, but it'll be less. And that less is what we need to reinforce those good behaviors and good things to focus on. You just really helped me today. My pleasure. My pleasure. My pleasure, my treasure. I'm happy to help. But this is why we do these lives, because it's really important. That's why I want to do these lives, because I'm going to be bringing things that I talk about to my patients every Tuesday, and you will all be able to hear the conversations and the types of things that I see and the type of cases that I deal with here for all of you, because this is all really, while we're not specifically treating you right here through this Instagram Live, but what we are doing is changing that mindset, changing that pre-frame, changing the idea that yes, you can go shopping for a medical professional, and that's okay. Yes, you can be out of pain even if you have been in pain for 15, 20 years. Yes, there is a way, a more specific way to treat your issues. Yes, movement is good for you, and don't just do complete rest. And there's so many things that we can talk about on and on and on and on and on. But this is why I want to do these lives. So, you identify the fear of pain and switch attention to the movement. It's doable. That's right. That's absolutely right. All right, so I gotta run. It's gym time for me. If anybody has any questions, shoot me a DM. I'm gonna do my very best to get back to everybody. If you are from New York, Florida, New Jersey. If you want to get a more specific approach to your pain, click the link in my bio, get a free 30-minute session. Spots are limited, so like we got flooded a few days ago with a bunch of requests, so we only have a couple spots left. So if you want to grab one of those free 30-minute sessions, definitely do so now, and we cannot wait to speak with you and just figure out what's going on. Again, no matter how long you've had it for, how little you've had it for, we're going to make sure that pain gets gone, leaves the body. Yeet, get it out of there. So yeah, definitely. Last thing here. I didn't expect it like that with my shoulder pain. Yes, now I realize that I was expecting pain every time I was going to reach for. Exactly. Drop that expectation. Don't think about it that way. Take a breath before every movement. Trust me, it's going to be easier. All right, so again, if you want a free 30-minute session, click the link in my bio. First come, first serve. Got a couple spots left. And I'll see you all again on the Instagram dance floor, and absolutely next week, Tuesday at 5, live at 5. I think that's what we're going to do. Yeah, that's what we're calling it. Live at 5 is the official name. All right, have a great evening, everybody. Talk to you soon, and have a great evening. Bye.